Post-traumatic stress disorder, PTSD, is a long-term and debilitating form of extreme anxiety that can occur in people who have experienced a life-threatening event.
The cost of PTSD in terms of quality of life is devastating. People have a hard time going to work, they have a hard time living their lives because this event from the past is in the present so much for them that it's hard for them to focus on anything else.
When we think about PTSD, we mainly think of war as the cause, but in actual fact, any life-threatening event could cause it, say a car accident. And these are events that could happen to anyone in everyday life.
Anytime your life is in danger and you respond to that with intense fear or helplessness, feeling out of control, that can set off PTSD.
And your study is in relation to heart disease.
So we're interested in when an individual has one of these acute cardiovascular events, like a heart attack, like a stroke, it's life-threatening, it's terrifying. I mean, people who have strokes talk about being awake and alert when abruptly and progressively they start feeling parts of their bodies are no longer under their control. They don't know what's happening. They're completely out of control. They're afraid that they're going to die. And what we're finding is that a substantial proportion of those stroke patients and heart attack patients develop PTSD due to that life-threatening medical cardiovascular event. And what we know from 24 studies is that about 1 in 8 of those heart attack patients are going to develop PTSD because of that heart attack.
Do you know what factors make one person get PTSD and another person not get it?
Interestingly, how bad the heart attack is objectively has very little to do with whether a person is going to develop PTSD. What really matters are things like your psychological response to that event. So the more that you feel like your life is in danger during it, the more out of control you feel. But then demographic factors too, so things like younger age in particular. So the younger you are when you have a heart attack, the more psychologically disruptive it seems to be.
What about the treatment that you get from the healthcare system, the doctors and nurses? Does that have an effect on whether or not you're likely to get PTSD?
We think so. So most heart attack patients come through the emergency department. Some of them come through emergency departments that are calm, half empty, people waiting there with open arms ready to take care of you. Other people walk into emergency departments that are overcrowded and chaotic, loud, and there's a gunshot victim in the bed next to you. Okay, these are very different experiences. And so we're interested in determining whether those types of factors that are happening during your treatment for heart attack might then carry forward to PTSD later.
Now, there's a bit of a catch-22 for people who have PTSD and need treatment to lower their risk of having a second heart attack. The normal treatment is psychotherapy, talking about the event, but with people with PTSD, talking about the event only makes them more stressed.
People who develop PTSD have a very peculiar sort of physiological profile. They have a tendency, because they're so hyper-aroused all the time in that kind of fight or flight mode, they have increased autonomic imbalance. So the sympathetic nervous system that keys you up is overactive. Fast pulse, your heart's beating faster. Not only that, but it tends not to come down, so it stays at that kind of fast rate. You're twitchy, on edge. And you can imagine that for cardiovascular disease patients, that type of physiological profile is potentially damaging.
So what are the consequences for your rehabilitation and life after your heart attack?
What we've seen across 3 studies is that people who develop PTSD after a heart attack, because of that heart attack, are about twice as likely in the next 1 to 3 years to have another heart attack or die.
That's a considerable increase.
It's a considerable increase, and that's adjusted for all kinds of demographic and clinical factors.
And that's the physiological stress on the heart.
We think that's what it is. I mean, so we don't know how quickly that added physiological stress leads to heart attacks. We know that that's one of the mechanisms that we're going after.
People argue that stress doesn't cause heart attacks, but in Australia, studies have shown that the rate of heart attack increases during the AFL football grand final. So is this a case of stress upon stress causing the follow-on heart attack?
It's one of the theories. It's one of the theories. So there are a number of theories. One of the theories is that it's just that heightened level of arousal over time is just wear and tear. It's causing more inflammation in the system. It's sort of just building up what was already bad risk factors anyway, just making them worse, and eventually something gives. There are other theories. One of them is this sort of every time that those thoughts come flashing back about the first heart attack, it's just a spike, more of that arousal, and then maybe that sets off an event.
So does treating PTSD actually make a difference?
There's only been one study, and it was just a safety trial. It didn't have enough people in it to determine whether treating PTSD would then offset that risk. After a heart attack, or a stroke for that matter, if you're feeling these types of experiences, if the event keeps coming back to you in unbidden thoughts, that these thoughts just keep coming and you can't push them away, if you're having nightmares, if you're having flashbacks, if you keep trying to avoid thinking about the event and can't, if you find yourself keyed up all the time, for a few weeks, that's to be expected. This is a traumatic event. It's really after a month that it becomes something that we're really concerned about. And at that point, go get treatment. We have very good treatments for PTSD. They're not perfect. They don't work for everyone, but they work for a lot of people.
Now, the other thing that happens for people that have had a life-threatening event in hospital is that as part of their rehabilitation, they need to go back to the hospital, back to the doctor, nurses, have the same tests, and that this can bring the event back, make it very real. So they want to avoid these situations, and they tend to not get the high-quality care that they need for a good rehabilitation. What does your study show?
What if every time a person looks at that medicine bottle, it's a potent reminder of that first event? And what if consciously or unconsciously, probably unconsciously, people are avoiding taking those medications because of the psychological impact of having to do that day in and day out? And we found indeed that's true. People who develop PTSD due to a stroke are 3 times more likely than those who don't develop PTSD to be non-adherent to their medication regimen.
If you need more information or support, contact Beyond Blue or Lifeline or discuss it with your GP.